Hello, I'm Jonathan Busco, and I'd like to talk to you briefly about the Community Health Services Access Needs Assessment. This is a process that my colleagues and I at St. Joseph Healthcare and Community Care Partnership of Maine have developed and continue to refine. We've done this in several communities. What is this process? Well, in the process, we come to the community and work with the community to identify health service access needs. What are those health services you don't have access to, but you wish that you did, that you feel that you need? We then help you generate solutions to those gaps. Find ways, often creative and unconventional, of getting access to those services. How does this differ from, say, some of the other community surveys or even community health needs assessments conducted by healthcare systems that you may have gone through in the past? The whole focus of the Community Health Services Access Needs Assessment process is on the community. We come in and we use surveys, we use interviews, and we use a town hall to identify what you as the community identify as your most important health service access gaps. We then work with work groups made up of your community members and subject matter experts who help come up with solutions, ways of filling those gaps. And we bring those solutions back to you in the community, where you can look at them, consider them, discuss them, decide, are these the most important things? Yes, they are. No, they're not. Do we want to implement these solutions? We'd certainly want to look at them, or no, these aren't the right solutions. And based on that, we then help you identify the cost of implementing the solutions, look for possible grants and funding sources, find partners who will help deliver those services to you, and ultimately you as a community decide whether or not to enact those solutions once you know the costs, once you know the impact, once you know what those solutions will truly look like. How does this differ from some other experiences you may have had? Well, with the Community Health Needs Assessment, these are conducted by healthcare systems as required by law, and they'll come in and they'll do many of the same things we do with the interviews and surveys to determine what the needs are. But then they take that information, usually they go back to their own healthcare system, and they come up with solutions that work within their strategic plan and the way that they would intend to deliver services if they can. They really leave, for the most part, communities out of developing those final mile solutions. What are we actually going to implement? For you, in the Community Health Services Access Needs Assessment process, you generate the solutions, because we believe that if you're smart enough to know what services you need, know where the gaps are, you're also smart enough to come up with the solutions, and to come up with solutions that align with your personal and community strategic goals, where you want to be as a community, not where some outside entity thinks that you should be. So this process is very interactive. We depend on you as community members in every stage of the process, and ultimately your community members, the steering team made up of members of your community, take over the process, and we support you so you as a community make the best decision for you in a way that's most impactful and most personal. You have ownership of your solutions. Hopefully this explanation makes you feel more excited about the process, knowing that you get to drive it, and I'm glad you were able to watch this and look forward to working with you.